but I'm on my own face, so I'm okay. Okay, so you put your fingers just a little bit inside the ear. No, for me. Stop, 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 stop. You're going to do it on me.
All right. Yeah.
Okay, so you put your fingers in and pull forward. Right, and then you ask the patient open and close mouth. And you should feel a little difference from side to side.
This is a test, right?
A test to see jaw movement. Because a lot of the time when you see people move their jaws, they can get a locking jaw, they go open, or they can get a jaw that goes off a J curve, like this can go, and that's obvious, there's a problem, or they could get a jaw that goes S, you know, wobble sideways, like this, J curve like that, or jaw that locks, okay? Those are some of the main ones. But you would see those easily when they have jaw problems, and they should see a dentist, TMJ, orthopedic person for those big problems. But the more subtle, littler problems that cause headaches don't show that very often, maybe only very small, and this is how to feel. Who would like to feel my jaw first?
你要去碰一下他的这个下巴。
You're going to go fingers in the ear.
就是试一下，看看他两边有没有松那样。你要把手插到他耳朵里，
You
然
want
后
to do
往
it?
前。
First? Come on, fun. Put your fingers in my ears.
往前。
Wait, wait, deeper. There? Feel there? Same or different?
不一样。
Feel the same or different on the side?
不一样。Different. Different.
Your turn. So this shows you the jaw is moving a little bit differently because of jaw muscles. Pull forward. Little softer. Little softer. That's it. Slow jaw movement.
Yep.
So my jaw is going slightly.
It's like this side a little more outside.
Yep.
Yeah, and this side is more like. How to say it?
Internal?
I thought this side is closer to my fingers. This side is a little
Further.
Yes,
yes. What you're feeling is my jaw going slightly this way, a slight J, reverse J. Okay, but that's okay. I just wanted you to be able to feel that. Now that tells you for sure that there is different muscle tension on each side. So I will lie down, or I will do it for sitting up. So you start this time. Put your fingers on my jaw, and you feel. Go deeper. I like it a little hard. Some people softer. Feel around. Do you feel the same or a little bit different in the muscle there?
This side is a little tight actually.
Correct. You feel?
对的。要压住，就是后
You
面
need deeper.
压重一点。
Now you feel a little not there, but here that's the same.
这边会重一点。
Feel different or same? Yes, correct. Now if you come back here, problem here. Feel that one?
然后后面那
That
个
is
红色的
another muscle. Okay.
So this side is muscle is a little higher.
Yes, correct. And there is a smaller muscle on this side trying to pull back. So there is one muscle, big muscle that is tighter, and a little muscle here that is very tight to stabilize. Okay. We're going to just do jaw massage now. Okay. I haven't shown you all the other information. That is okay. However, you can do this jaw massage. This is fine to do. Okay, just on the outside. So what you would do, put your hands on my jaw. No, on my yeah. Both. Feel that? Okay. Now you feel. Okay, just still. Okay. Feel. You feel the jaw now. I'm going to get you to work and feel for the knot to release. So this is how you would release this one. The muscle goes up and down, so you move back and forth to release. Right.
Oh, a little deeper.
That's it. That's it. Feel that one really moving?
Yes.
That's the big one. Okay, now.
对，这边有一块，它那边要重
Quite
一点。
deep.
为什么会长这样？
不是，它这边呢比较紧。
哦。
这边比较紧。
I can feel that here in my head. When you push there, I feel it here. Okay.
它那边很紧。
就是从这边它容易跑。
对，它这边对这边
One
很
goes to here.
拉到
The pain is here. You push here, I feel here. Okay. So now we would have the patient lying down. You would work their jaw, but you sometimes find there is asymmetry. Do you know what asymmetry means? It means the opposite of symmetrical, so not balanced, different on each side, asymmetry.
不平衡。
哦。是因为会吃东西一直某一边的关系。
Is that because of the eating habit? Because they use one side more, one side less.
所以他都习惯用这边。
Three teeth?
对。
Missing teeth.
哦，牙齿。所以他两边。
I lost a tooth.
Yeah.
Okay. So, where were we? That's right. Okay. So we've gone through the jaw. Okay. There. Now you want to find this one on this side, and there's a little muscle up top here that is also tight. So you feel up here. Come up here. Feel that one? Yeah, that one there, right? Yeah. Actually, just back a little more. You can quite. One finger. One finger.
All right, I got it.
Got it? Okay. Finger. Quite deep. Quite hard. Okay. So muscle here, different, same or different position. Same or different, right? Do you feel here? Feel that one?
Yeah.
So this makes my jaw go, when I open it pulls in different directions because the muscles aren't in the same position. There's two different muscles that we're looking at. Now, so you would work on the patient, if they are okay, start more gently and then get deeper and deeper to release both sides. They may feel it replicate their headache. They may say, oh, that makes my headache stronger. So you want to tell them before, say, this may make your headache feel stronger and it will help release it. Okay, so you work on that. Then, you can also feel up in the temples and find here. Okay, got that? Feel there? Okay, that comes from here, this one to here. Right? There's different positions for different muscles. Okay, that one to there. Can I get you here? No, up here. No. There.
Yep.
There. Feel that?
Yep.
Okay, it's weird doing it with someone else's finger. Okay, on this side, it is more forward. There it is there. Finger, right there. That's it. Yep.
Yep.
You feel that? Feel that one? Feel that one? There we go.
左侧脸是在这边，但是右侧是在上面的。这两边不一样，可能会不一样，和肌肉不一样。
Starting to soften up already. Okay. So right through there. Push hard. Let me feel you do it. Good. Yep, that's perfect. Can you feel the knot? Can you feel it? Yeah. Okay. Now, Vicky, I want you to find and feel on your own. Harder. A little bit here. Try it. That's. Yep. Can you feel it? Okay. And I can feel that in my mouth. I can feel it here. When you're pushing here, I feel here. When you push here, I feel here. Do you find it on your own? you've got the edge of it. Try and get it a little more. No, not harder. Change your position. Change your position. Go forward more. That's the one. You got it. Okay? And you do that until it starts to release. Okay? Now you can also work on the base of their skull a little bit, and also on the muscles in the upper back here. Because remember those ones tilting the head back? Yeah. Okay? So, now, that is how you find it, that is how you release it, and you need to remember, before you start working on them, to say, when I push here, it may make the headache
a little stronger, yeah.
But that's how it lets go.
After it will be released.
Yes, and after you'll go, oh, feels like someone's taken bricks off my brain. Okay, now I would like to ask, do you have any questions?
有问题？没有，你就待会我会跟你讲的，就是 so when we released jaw muscle on this side, on left side, it should be here, right?
Oh, it would change for everybody.
Okay.
Change for everybody. Depends on chewing pattern, punch in the face, teeth position. Changes for everyone.
So does this two side muscles the same or the same position or is different muscles?
Sometimes the same muscles are tight.
Yeah, okay.
Sometimes different muscles tight.
Okay.
Sometimes different positions in the same muscles. So if it was this muscle, the bicep here, it could be on the left arm, or sorry, the left jaw. It could be up here, and on the right one, it could be down here. Okay, so it could be the same muscle, but a different position for the tightness because of how they chew. Many fibers in the one muscle.
So I mean, for this two side, the muscle is the same, right? The muscles on the two sides are the same.
Yeah, so they're born with the same.
But different parts feel tight. Yeah.
Yes, because of different use.
All right.
If I give you, say go to the gym, and I give you 20 kilos for this hand, 2 kilos for this hand, and you do the exercises, which one is different? Stronger?
This one.
Will it get bigger? Yeah. You can see that? Yeah. Even though you're chewing, you get one nut, you put it in your mouth. Which side do you put it on? Maybe left, right. One, you don't put it on, it doesn't go both sides in one go.
That's right, yeah.
First one always bites harder. Do you have mint outside? Mint for customers?
We used to.
Oh, right, okay. Okay, so I should have brought something like that. I think I will include that in another lesson. You get a mint, you put it in your mouth, and you say, now chew, and people will put it on one side nearly every time.
Yeah, I'll put it on the right side,
So
maybe.
if I can get you just to come back on the camera, that's all right, no worries. Okay, that's okay. I don't mind you being there, just for the camera. Okay, so when you put it in, you usually push to one side or the other.
Yeah, one side.
Would you like to explain? All good? Okay, any other questions? I like questions.
Yeah, I'll fine with all of the massage.
Okay, excellent. Okay. Now, if there is anything that you would like me to clarify, you have any other questions later on, you should always ask me. I'm very happy to help.
Yeah, sure.
I will give my number to you all again. Okay. One thing which I would like to remind you, the work inside the mouth is more advanced. I wanted to show you for the first time today. We can show you again another time. We can review, we can practice.
Yes.
Maybe if you want to practice on each other gently with good communication, that would be okay. But don't use it on normal patients until you've had more practice and maybe done 15, 20 people that are friends or work colleagues is what I mean, that know what is coming. Okay? And you want to do people that have problems a few times to work the inside. The outside is pretty good, pretty easy, but people get a little bit uncomfortable, so you want to get your technique right for comfort. Okay, so very important to remember. Did you want to translate for me on that?
She got a question. But
Sleeping and grinding.
you say the teeth here. Do something like this.
When you're sleeping, grinding.
Yeah, grinding.
Bruxism is the.
She's like, is it still because of the tight muscle or?
Can be or stress.
Okay.
I'll just pause the video while you get that. That basically concludes the